Now, today we all will be talking about the infertility related issue. Infertility related issue means, what do you mean by infertility? Can anyone tell me? Can anyone tell me what do you mean by the infertility? Yes, fast. See, I had given you a very simple definition of infertility in regular class. Can anyone tell me what's that? I've given one duration, that in so and so duration, if the couple are not able to conceive after regular or unprotected cohabitation, so that is called as the infertility. So can anyone tell me what is that period? After what period we will consider? It is how many months? Very good. After 1 year of cohabitation, if a couple is not able to conceive, that particular problem is called as infertility, and we have discussed about it in detail. So, what are the causes of infertility? There are many causes. Infertility in a couple can be of various type. It could be related to the male infertility, or it could be the female infertility. Now today we all will be talking about the infertility related disorders. When we say the infertility related disorders, so that means there are certain problems, okay, that is causing the infertility. Now infertility related issues or causes are many, like today especially for this lecture we will be talking about the female infertility problem. So we have seen that there are lot many causes of infertility in female, like a female is not able to ovulate, and the female is producing the infertile egg, damages there somewhere into the oviduct, or maybe the oviduct is blocked, damage to the uterus is there. There are certain damage to the cervix region. There female is producing to the antibody, or maybe there are some genetic causes of abortion. But see here, there are certain diseases or disorder which causes the infertility in female. So these are, just a minute, student. These are the first is the endometriosis, then Pcos, ovulatory dysfunction, hyper Antigenism. In that two are sorry, PCODs may be two problems we will discuss. Then here premature ovarian follicle, then your sexually transmitted disease or infection, you can say. So we will discuss one by one. First problem is a very painful problem, that is endometriosis. Now what happens in the endometriosis? In this particular situation, the cells of endometrium. Now what is endometrium, students? We have learned that there are three walls of the uterus, right? So the innermost wall is called as the endometrium. This wall have a very important role. In the last lecture only we have learned about the endometrium. You remember that this layer, it increase in size, get thickened and prevent the pregnancy. You all remember in the last lecture we have discussed about it. So here, just a minute, Stu. So when we talk about the endometrium and the importance of the endometrium, we all know that in the regular normal female, after the fertilization, the endometrium get thickened and close here, right? But why and how this is happening? This is happening by the proliferation of the endometrial cell. So here, what should happen? The endometrium should get thickened at this particular site. But instead of that, in the case of the endometriosis, this endometrium, it is forming to the various part. Like you can see here, here also, here also, here also. So it's so many places. So what exactly happening in the case of the endometriosis? The endometrial cells, which are responsible for the thickening of the endometrium, they grow outside, or they proliferate outside the uterus. They should proliferate inside the uterus, but bachcho, in this particular case it is going to proliferate outside the uterus. Now see, endometrium, we all have seen that it grows, and whenever there is a discharge of the ovarian mature ovarian happens, when this mature ovarian discharge at the time of the menstrual discharge, है ना, this endometrium breakdown and it discharge through the opening of the cervix. So now when the ovarian, now this maintenance of the endometrium is responsible for the hormone. The female herself is not having any issue with the hormonal cycle. The ova is absolutely normal. So this endometrium cell, they will also shed off when the ova will discharge from the body. But now if it is growing to the ectopic position, that means instead of inner side of the uterus, if it is going growing somewhere here, 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 so what will happen? This is also going to shed at the time of the menstrual discharge. But now here, if it is been discharging from here, so definitely it will go to the cervix and the discharge will go out of the cervix. But here, if this will discharge, so this blood will go to the abdominal cavity. Understood? So this is going to cause abdominal pain, and thickening become now this is happening. The other issue, but what is the infertility situation in this? Endometrium cells, it is not forming and proliferating inside the uterus, so it is going to cause a lot of problem. It is going to create the problem into the menstruation organ of the abdominal cavity, will also get pain. Why? Because of the bleeding. The blood should go out of the body, but here the blood is going inside the abdominal cavity. So whatever organs are present inside the abdominal cavity, they will receive that blood flow, and they will also get discomfort, and this produces pain. And this endometriosis, which degenerated over the period of time, the scar tissue start joining between the two organs. Say example, in between, if this endometrium is forming, so this endometrial cell will proliferate and it will join the adhesion of the organ. And not only the infertility, this adhesion can distort the organs, and it make more and more difficult for a woman to get the other issues also. Not only the infertility issue, she may get the many other abdominal issues, and she will get the abdominal pain. And even it can, in the severe case, there is a scarring, there is a formation of adhesion and abnormal mass into the pelvic organ. So this endometriosis, it is not very common, but still 1 to 3% of the infertile women are posing this particular problem. This is an increased chance of endometriosis in women, those who are having uterine cycle less than of 27 days, or those who have heavy menstrual flow for more than 1 week. So if such issues are there, the person should check with the endometriosis. The woman who use the birth control pills for the long period of time, or maybe the woman those who have the several pregnancy, so they have the reduced chances of the endometriosis. Now what could be the treatment? So the laparoscopy can be used to do view the abdominal and the pelvic organ for the endometriosis, and it is particularly useful for examine the adhesion which can be corrected by the surgically. Drugs can be administered which stops the production of estrogen, or ovaries can be removed, because see, if ovary will produce, so with the estrogen this endometrium will get thickened. We all have seen na, the hormones, these are causing the thickening of the endometrium. So if the problem is infertility, it is okay, there are other treatment, but this endometriosis, it is causing so many health issues. So in the severe case, when other organs will start adhering because of the scars and joining of this endometrium to in between two septa like structures are been formed, so ovaries can be removed by surgery. So this is one of the most painful infertility in case of woman. Now second infertility related disorder is the polycystic ovarian syndrome. It is the most common endocrine hormonal imbalance. Now see, when it is happening, now this PCOD affects the woman of the reproductive age. What do you mean by the reproductive age? Reproductive age of a woman, it starts from the puberty, when the woman gets its first menses, and it ends till the menopause. So that particular age of a woman is called as the reproductive age, and this causes an unregulated female infertility. It is not a single endocrine disease. Means so we cannot say yes, this hormone is happening. So because of this hormonal disturbance, PCOS has formed. It is a complex disorder or syndrome which characterized by the number of signs and symptoms. Now, what happens when the PCOS happen? There are various symptoms. First thing, menstrual difficulties, high androgen level, then multiple ovarian cyst. Ovarian cyst means the follicle which multiple ovarian follicle forms. Now we all have seen that when the follicle stimulating hormone stimulates ovary, few follicles form and out of that one matures. But here what happened, the extra follicles they convert into the cyst instead of degenerating. Understood? So this multiple ovarian cyst form, pain in the pelvic area, then there are skin patches, obesity. This particular disorder was first described by the Stein Leventhal in the year 1935 as a triad of amenorrhea. He was having the means he found that the women, those who are having amenorrhea, amenorrhea means absence of menses, then obesity and hirsutism. They PCOD is quite common, means you can say approximate 5 to 10% of women of childbearing age. Again, childbearing age means the reproductive age, they are affected with the 5 to 10%, but because of the sedimentary lifestyle, the numbers are quite high nowadays. Majority of the case, the infertility is been found because of the PCOS. Now the girls, those who begin the puberty before the age of 8 years, they have the increased chances. Now, see what is the correct reproductive age. Actually, it should start after the 10 years and preferably between 12 to 15. But there are girls those who get the early puberty, so they are at the high risk of the PCOS in their later life. Not necessary whenever they will get their menses immediately they will show the PCOS problem, but they may have the PCOS chances into the later life. There are no specific tests that exist and diagnose PCOS. The sonography, well, now see, every now and then we will not go and do the sonography. It can be diagnosed by the sonography, but PCOS can be identified by few type of the criteria. So the first criteria is the ovulatory dysfunction. Now, what is this ovulatory dysfunction, student? Here, in the case of that, the luteinizing hormone and follicle stimulating hormone ratio will increase. Understood? Their quantity will increase because I told you here the extra follicle stimulating hormone. What is the function of the follicle stimulating hormone? Follicle stimulating hormone, it stimulates the ovary to produce the follicle. Understood? And luteinizing hormone, it is supporting the mature follicles and supports and also stimulates the estrogen production. But in this case, what happened? This hormone, children, I have told you many times, these hormones are produced in body in a trace amount. But when their quantity increase, the trace amount means into the nanograms. But if their quantity increase in the body, now how their quantity increase in the body? Because of the stress, because of the junk food, and because of the various other situation when we are coming in some chemical contact or some other issues. So that particular time, what happened that when this ratio increase, so ovary get extra stimulated, some extra follicles are formed, and sometimes chronic anovulation also happen. So that also causes the ovulatory dysfunction. Now, what happened? This ovulatory dysfunction results into the menstrual irregularities. Now, sometimes the female may get the oligomenorrhea. Oligomenorrhea means infrequent menstrual periods, and even the female may get the amenorrhea. Amenorrhea is absence of the menstrual cycle. So here, when the it depends on the number of cysts are produced into the ovary and how much ovary is damage. Now you can see here, student, in the case of the normal ovary, one follicle is only developing. But here you can see the multiple follicles are there. है ना? So these are the various issues. Now there are other criteria also of PCOS, that is hyperantigenism. What is that? Here, in this case, the androgen are produced more, understood, from the ovary. Now, see why it is happening. It is happening because of hyperinsulinemia, that is, elevated level of insulin in the body. Now, when the insulin level eliminates in our body, what is the function of the insulin hormone, student? What is the function of insulin hormone? Can anyone tell me, please? Come on, fast. What is the function of insulin hormone? Very good, beta. It regulates the blood sugar level. Now, here I said hyperinsulinemia causes the hyperandrogenism. So, what happens? When the level of the insulin elevated in the body, now when the insulin level will eliminate in the body, when you will take more and more glucose, more and more carbs in your diet. Understood? So that particular time, that means you are eating lots of junk food. Understood? So for that particular time, hyperandrogenism happens. Now what are the signs of it? First, the most pathetic sign is the virilization. That is, you can say, the maleness type of thing. Then male pattern baldness will happen, acne will happen. Then you will also observe the abnormal hair growth like male on the body parts, especially near the breast region. The exact cause of PCOS are not known, but these are related to the endocrine, genetic, or the environmental factor. One of the major factor of increased incidence of the PCOS is observed is the obesity. 60% of the affected women have found they are obese. So obesity is one of the major cause, because we have seen that, see, we say these are the sex hormone, these are the regulatory hormone, but all the hormones are under the control of the master gland, right? So whenever there is a disturbance, and all the hormones are interrelated, so whenever there is a hormonal disturbance, not necessarily that the reproductive hormone only, it can cause the various problems. Now see, whenever we will go to the gynec and we will say some reproductive related issue, the gynec will ask you to check the, she will not ask you to go and check LH and FSH until unless it is not some infertility related issue, but she will ask you to check TSH first. That is the metabolism hormone. No? Thyroid hormone is the metabolism hormone. So all these hormones are interrelated. Now, PCOS affected women are also at increased risk of the dysfunctional bleeding. They are increased risk of the miscarriages. Even they are at the increased risk of the endometrial cancer. Even they may have the insulin resistance. They may also can face the type 2 diabetes, then dyslipidemia, hypertension, cardiovascular disease. So, see, all these problems are interrelated. So, women with PCOS, they are generally exhibit the increased serum luteinizing hormone concentration, low normal FSH level, and even if you will observe the ratio of LH and FS, it is going to be higher. So there is no specific cure कि चलो आपने ये दवा खा लिया तो आपका PCOS ठीक हो जाएगा. The main thing is we can do the symptomatic treatment, and the best thing about the PCOS is managing the lifestyle, because if you all will observe the causes of the PCO, you will find that it is related to the lifestyle issue, है ना? So the main thing that we can do the lots of exercise. Now, treatment involves lowering the insulin level, restoration of the menstrual cycle, and fertility treatment of acne and all. So, to achieve all these things, simply what we can do, I told you that you have to check with your lifestyle. One, so you will check the count of your lifestyle, that what are you eating, what is your lifestyle, are you lethargic, understood? So for that time you will find that when you have done the modification into the lifestyle, automatically weight will reduce, है ना? You are doing the exercise, you are taking the diet care, so this dietary changes, this burning of the carbohydrate will definitely will help. Other medication and sometimes even surgery also required for treating it, but the best thing to treat the PCO, now see, we ignore when we get fat, है ना? We think the this is the reason of obesity. अभी मेरा जो है जॉब स्टाइल ऐसा है, मैं ऑनलाइन काम कर रही हूँ, आई एम नॉट गोइंग टू द कॉलेज, दिस एंड दैट. We just keep on giving excuses to ourselves, but the body will not be able to tolerate all this excuse. You have to answer to yourself to evaluate your regular activity, understand? So you have to check your body, you have to take care of your diet, you have to take care of your lifestyle. So with the help of that, definitely we can cope up with this. I cannot say that the PCO will go 100%, but still the further complication will not be increased. Now let us go to the next disease, that is POF, premature ovarian failure. Now see, it is also called as the primary ovarian failure. Now when woman's ovaries stop working before 40, है ना? Before 40, हाँ. आप बोलोगे कि मेनोपॉज सिचुएशन, तो नो, इट इज़ नॉट लाइक दैट. Before the age of 40, if the ovary will stop working, so that particular time, now see, if ova is not there, so there is no chance that the woman will become pregnant normally. So this is known, also known as the POI, that is primary ovarian insufficiency. So now when it happens, sometimes it exists from the birth, or sometime it occur during early teenage. Ovarian dysfunction results into the loss of egg at the young age, and not normal physiological occurrence will happen in POF. Now see, I have compared here. This is the normal ovary and this is POF ovary. So here in the normal ovary you can see a complete ovarian cycle is there, na? Here from here primary follicle, secondary follicle, followed by the graphene follicle, है ना? We can see. But at the same time, if you will see, the ovary is free from any egg. No egg has been formed. Just a minute. Non-functional ovary. So here the ovum will not produce. So in POF, high level of circulating FSH causes abnormally low level of circulating estrogen. So at that particular time, the eggs are irregular or absent. Now see here what happened in the early age. They are having the high level of, now we have the limited number of the follicles in our ovary which are formed before birth. है ना? So in some women what happened due to the high level of FSH in the early teenage only, their all follicles get finished. So after that their menstrual, they will get the menopause. Understood? So POF is not natural menopause, because see, when we talk about the menopause, it is expected physiological decline of ovarian function that take place because of the aging. Na? With age that ova get finished and we get the menopause. So it is not like that, in which ovary supply a woman with eggs about मतलब see here menopause, if we will say the natural age of menopause is generally after 50, 51, 52, like this. But here the menopause occurs at the earlier age. POF is a result of either a deficiency or excess of ovarian follicle. Follicle depletion may result from the genetic disorder, like a person is having the fragile egg syndrome, or the person may have the Turner syndrome, or other causes of ovarian failure. It also includes chemotherapy, radiation therapy, which is used for the treatment of the cancer. Maybe a cigarette, a woman who is smoking. So smoking is a major reason in the normal circumstances. Chemicals, pesticides, and viruses are also other causes of that. But see, in the normal and the natural condition, if anything which is causing this POF is the smoking. Now, follicular dysfunction results in autoimmune disease from damage to the egg, which containing the follicle and consequently the egg. The other causes include the hysterectomy, or maybe the pelvic surgery, endometriosis, enzyme defect, tuberculosis, etc. Irregular menstrual period and symptom of the menopause such as hot flash, night sweat, irritability, vaginal dryness, or maybe the low sex drive at the reproductive age, and difficulty in sleeping are often observed. POF is diagnosed. How it is diagnosed? It is diagnosed by conducting tests of checking the level of FSH and estradiol, that is the estrogen hormone, into the blood. Then prolactin level, karyotype testing during pregnancy. At present, there is no way to prevent the primary ovarian insufficiency. Treatment focuses on the estrogen therapy, then calcium and vitamin supplement. Infertility can only be addressed by using the donor eggs, and after also IVF, because here if the eggs are only not there, how the estrogen will form? Understood, na? So as far as ovary do not have any egg. Now for pregnancy, ovum is required. So this particular infertility have only one and one option, that we have to rely on the donor egg. We have learned about the egg banks, sperm banks, no? So from there we can just take the egg, and thereafter IVF. Now why IVF? because as such the normal hormones are not been produced. Understood? So the normal hormonal cycle will not be restored. So better for option is the IVF. Women with this condition have higher risk of thinning of bones, that is the osteoporosis. Now she may also this face the problem of the multiple fracture, especially into the wrist and the hip fracture due to reduced bone density. May also face the diabetes, heart disease, depression, or you can say the anxiety. Now next, and the most worst condition is the sexually transmitted infection, or it is also called as the sexually transmitted disease. So, disease or infection of the reproductive tract which are transmitted through the sexual contacts, they are called as the reproductive tract infection. That is RTI, reproductive tract infection. What it is called as sexually transmitted infection or reproductive tract infection. Now see, all these are venereal diseases. Some examples are HIV/AIDS, human papilloma virus, genital warts, then candidiasis, gonorrhea, chlamydia, syphilis, genital herpes. So these are the some common sexually transmitted infection which play important role in infertility. Social stigma attached to the this sexually transmitted infection, you have seen that the many of the time the people cannot say, even cannot treat if they get the sexually transmitted infection, right? So because of that they are not able to seek the this medical help in time. This could result into the complication, understand? And not only complications, sometimes it causes uh, severe complications and even cause the death. Some examples are chlamydia, gonorrhea infection. They may lead to the pelvic inflammatory disease and even infertility. So some diseases only we will discuss. There are many, but in our syllabus we have only four. So today we all are going to discuss only the four sexually transmitted diseases, in which the first one is the gonorrhea. It is caused by the bacterium Neisseria gonorrhoeae, and it is the second most common cause of the infertility in women. Now see, this particular disease is caused by the bacteria, and this bacteria Neisseria gonorrhoeae, it produces the bacterial toxin. Understand? And this toxin produces the redness and swelling at the site of infection. That means into the this is sexually transmitted disease, so definitely it is going to present inside the genital organ. So this bacterial toxin produces redness and swelling at the site of infection. Now this bacterial toxin can be transferred. Now what are the symptoms of gonorrhea? In the case of the male, they have the painful urination, even the discharge of pus from the penis, and infection can spread to the epididymis. Now we all have seen that the testes have connection with the epididymis. So this infection can spread to the epididymis. Approximately 60% of infected female either do not have any symptoms occurred into the initial stage, or there may be a pus-filled vaginal discharge and burning sensation during the urination. Later, the infection can spread to the uterine tubes and ovaries. It can cause widespread of the pelvic infection, which can lead to the sterility. The antibiotic cephalosporin is used for the treatment of the gonorrhea. So this is one cause. Now second is the chlamydia. It is the most common cause of the infertility in women. Even it is observed that more than 15% of the women they have the infertility because of the chlamydia. Now, when and why this happen? This particular disease is been observed in the case of the 15% of the women. Student, just a minute. So this Chlamydia, it is actually observed into the female, those with the multiple sex partner. The causative agent is the bacterium. Now see earlier case also gonorrhea also we have seen that the causing agent is bacterium. The name of the bacteria is Chlamydia trachomatis. See all this bacteria name you have to remember for the MCQ purpose. Okay, bachcho? Now, this is transmitted through the unprotected oral, vaginal, or rectal sex contact with the infected individual. It is diagnosed by the swab or urine test into the laboratory. Female patients suffering from the chlamydia infection may have the vaginal discharge and experience the burning sensation during urination, but majority are frequently asymptomatic, and this disease often goes undetected. Means they get also, and this goes also. If left untreated, chlamydia can spread and infect other part of the female reproductive system like uterus, fallopian tube. So this causes the pelvic inflammatory disease, and this pelvic inflammatory disease it causes the infertility. Pregnant women carry the risk of passing of infection to their newborn babies. It is estimated that 1 in 5 women with chlamydia develop the pelvic inflammatory that causes fever and the abdominal pain. So treatment. So here we can take the doxycycline and azithromycin, which can use for the treatment of the chlamydia infection. In the case of the man, chlamydia can spread to the testicle and epididymis and can cause them to become painful and swollen if left untreated, and it could affect their fertility. Then next is the syphilis that caused by the bacteria, that is the Treponema pallidum. This disease has three distinct stages spared by the latent periods in which bacteria do not multiply. Latent period, there are various periods, na? So this is spread into three distinct stages separated by latent period in which bacteria do not reply. Patient with the syphilis initially have the small painless though highly infectious ulcer, or you can say the skin lesions at the site of infection. This is primary stage which lasts for the few weeks. Then the bacteria enter through the infected skin and it can spread via the lymphatic node, and even this bacteria it do not remain into the genital tract only, because it is attacking the lymphatic tract. So it enters into the blood circulation. Now when it is in blood circulation, that means it is in all the body. So this lead to widespread the skin rash, flu like symptom, and stage may last for the month. Now this stage, I told you na, there are various stages. So the first what we all have seen, that the first the bacteria is entering है ना, in the body through the skin lesion or somewhere. So primary stage the bacteria will remain at the site of infection for few weeks. Then second stage we all have seen that it is invading the lymphatic nodes. Now once it is entered into the lymphatic system, it is going to enter into the circulation. Lymphatic circulation also we have, no? So once it has entered into the circulation, तो अब तो पूरे body में जाएगा. Is it or not? So it is going to spread to the whole body. So this is the third stage. After that, the prolonged tertiary stage will come. This can last for years, even 20 years it can remain in the body, which is highly infectious, scaly lesion teeming with bacteria, which are formed evenly lesions that is called as the may occur, which destroy the body surface. Even it causes damage to the organs such as liver, bones, spleen, even severe brain damage leading to the deterioration of the central nervous system, and it causes the death in 5 to 10% of cases. Treatment involves the administration of the penicillin, because this penicillin ruptures the bacterial cell wall. Now next is the genital herpes. See, in your syllabus, it's sexually transmitted infection. This is the only sexually transmitted infection which transfer by the virus. This is caused by the herpes simplex type 2 virus. This is tiny painful causes the tiny painful blisters which appears on the genital area, which can cause the itching or burning sensation and often accompanied with the inflammation and may develop into the ulcer. And after formation of the ulcer, a secondary infection will cause. Flu-like symptoms may occur when reoccur periodically and pose threat to the fetus, or you can say the newborn infant. Genital herpes also may predispose women to increase the incidence of the cervical cancer. There is no effective treatment or cure, but some drugs may shorten outbreak or reduce the severity of the symptom. So these are the all diseases which causes the infertility. So if you have any doubt, you can ask me. And student, even I am uploading this lecture for your reference. So whatever, see, lot many MCQ will be asked from this particular part, and I am going to take the revision of only those topics, those who have the large many MCQs in that. Okay, because it is declared that your exam is going to be the MCQ or online. So we can stop at this note if you don't have any doubt.